Hi, my name is Kristen O'Keefe, and this is my final exam. And my client is Catherine, and thank you, Catherine, for helping me do this. And so what we're going to start with, Catherine, is our blood pressure. And do you know what your blood pressure is? No? Okay, so I'm sure it's good. And I'm going to get up here. All right, so first thing I'm going to do is I'm going to check for your brachial. Sorry, wasn't tight enough. Okay, so I'm going to check for your brachial pulse. Okay, and I'm going to have you put up your hands so I can get a radial pulse. Okay, very good. So what I'm going to do is I'm going to pump this up until I can't feel a radial pulse. Okay, and then I'm going to go 30 millimeters over. And I'm going to listen to your blood pressure. Okay, you're 108/78, so very good. So next I'm going to check your skin, and I'm just going to check you for moisture and texture and temperature. And your skin looks nice and soft bilaterally, looks great. You have some fine villus hair. You don't have any marks on your body. You don't have any moles or anything or lesions that I can see, which is good. Your skin is warm and moist. You have good turgor, and you have nice recoil. Yeah, and everything looks good. Okay, if you had any lesions or any moles on your skin, we would measure them, and we would check them if they were elevated or anything like that. But you don't seem to have any, so that's nice. Okay, next I'm going to inspect your scalp. So I'm just going to put my hands through your hair, and your scalp feels nice and symmetrical. I don't feel any bumps or anything on it. And your skull, and your scalp looks nice and clean, and it's no flakes or anything like that. So, and your hair is nice and moist, and it's nice and light brown. And next, I'm going to check your facial. So I'm going to look at your eyes, and your eyes are symmetrical. Your mouth and your lips are symmetrical. Can you smile for me? Okay, everything is very symmetrical, and your ears align along with your eyes. So it's very good. That's what I'm looking for. So everything on your face looks symmetrical. And so now I'm going to check you for TMJ, and this is evaluating your cranial nerve number 5. So I'm just going to put my hands up here, and can I have you clench? Very good. And I'm going to come down here by your mandible, and I'm going to have you clench. Very good. And can you open your mouth? And can you close it? And can you go side to side? Very good. And can you protrude and contract, so out and in? Excellent. So I don't feel any clicking, or I don't hear any clicking, so that's good. So you don't have any TMJ. And then what I'm looking now is I'm going to evaluate your cranial nerves number 7 and 12. And what I'm going to have you do is I'm going to have you clench your eyes really, really tight. I'm going to try to open them, and don't let me. Okay, very good. All right, and I'm going to have you scrunch up your forehead. Scrunch it up. Perfect. And I'm going to have you puff up your cheeks. Okay, and I'm going to have you stick your tongue way out and bring it back in. Excellent. Okay, so that's good. All right, and then what I'm going to do now is inspect your eyes. So first, I'm going to look at your corneas, and I'm going to go from the side. And I would do this on both, but I'll just do one eye today, okay? And your corneas look nice and clear. Everything looks good. And now I'm just going to kind of look in, and your pupils constrict with light. I should shut it off completely, but I need to see you. And that looks good. And I would do it from both sides to make sure they were equal and reacted, and they look to light. Okay, and I can kind of go in and see that. Very good. Okay, and also I just want to check to make sure everything, your mucosa and everything looks nice and pink excuse me. Okay, and that looks good. Okay, and I'm gonna check for pupillary response, and this is also your cranial nerve number 3. So I'm gonna have you just follow my finger, and I'm gonna have you just bring it all the way in, and look at it, and come back out. Okay, so your pupils are equal reactant to light with accommodation. You have constriction and contraction, so very good. And now I'm gonna do some visual fields test on you, and this is for your cranial nerve number 2. So I'm gonna have you cover one of your eyes. I'm gonna have you cover your right eye. I'm opposite you, sorry. All right, so I'm just gonna, tell me when you can see my fingers, okay? Going in?
No. 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 No.
Very good, excellent. Okay, and so now I'm gonna test your extraocular movement, and this is your cranial nerve number 3 and 5. So I'm gonna have you look at my finger, and I'm just gonna have you follow it with your eyes. Follow it, up, down, in, over, up, down. Good, so your ocular movement was great, and you have no nystagmus, and that's when your eyes kind of shake a little bit. And usually you would see that if there was any issues, and you don't have any of that. And last I'm gonna do is just check your lacrimal ducts, and usually I would just sit there and we would kind of push on. If I had gloves, I'd do it more. But I'm just looking for any kind of regurg or anything in your eyes, and your eyes look great, okay? And so next, I'm gonna check your ears. And at first, I'm just gonna kind of look on the outside. In your ears, look, your cartilage is all intact, the auricle is nicely formed, everything looks okay. Are you having any issues with your ears? No? No swelling or drainage or anything, no pain? Okay, so I'm gonna go in, let me know if it hurt. I'm just gonna kind of go in first, and I want to, gonna go in to the canal. And I'm gonna go look for the tympanic membrane. So I see some fine villus here. I see some wax. I see your tympanic membrane. And then I see the cone of light. Very good. Okay, excellent. All right, and now I'm going to do a hearing test on you. And it's called a whisper test. So I'm gonna have you cover that ear with your hand, and I'm gonna whisper 3 words to you, and you let me know what they are.
Cat, dog, mouse.
Very good. Okay, so I'm gonna do the Weber test, and this is checking out, and the whisper test is checking out your cranial nerve number 8. And so what I'm gonna do is I'm gonna tap a wand on top of the head, and I just want you to tell me if you can hear it in both ears, one ear, or neither ear. Okay?
Both ears.
Very good. Okay, and then I'm gonna do the Rhine test, which is I'm just checking bone conduction. And so I'm gonna put it behind your ear, and I want you to listen to it. When you can't hear it anymore, say, done, and then bring it up here, and then let me know when you can hear it. Okay? All right, so let me know.
Done. Done.
Okay, so it's great. It's 2 to 1, and you would hear it longer back here and quicker there, and longer forward, but very good. So you passed that test. Excellent. All right, so, and then next I'm gonna do is I'm gonna check your nasal mucosa and just your nose, okay? So your nose is midline. Everything looks equal and symmetrical, which I'm looking for. Can I have you lift your head? Thank you. I'm just gonna look up. Okay, and what I'm looking for is sternum is very straight, turbinates are good, you got fine villus hair, you really don't have any drainage whatsoever, everything looks pink in there, and you're not having any drainage or any issues with that? No? Okay, and then what I'm now going to do is I'm just going to palpate your sinuses, so I'm just going to lightly press on them. Okay, I don't feel any bulging or anything, there's no redness, and if I tap on them, do they hurt? And is there any pain there? No? Everything okay? All right, and then what I'm going to do is I'm just going to check your mouth right now. And I'm going to look in and I'm just going to check to see how your mouth looks. I'm gonna have you open up your mouth.
It's done.
Oh.
I'm back again.
Okay, so I'm just gonna look into your mouth. I'm gonna have you open up wide, and I'm gonna have say ah. All right, so I can see that uvula, and that's nice and midline, and that looks good. Your teeth are all white, and the enamel's intact. Can I have you smile? And everything looks nice and straight. I'm gonna have you open your mouth one more time, and I'm gonna look up. In your hard palate, it's nice and pink, and it looks good. And I'm gonna have you open this, can you stick your tongue out on me? I'm just gonna look in the side of your tongue. Okay, can you point your tongue over to the side, right out? Excellent. Okay, I'm gonna have you put your tongue on the top of your roof of your mouth and open your mouth. So stick it up on the top of your mouth, yeah, and open. Okay, so I'm just looking underneath your tongue. And when I'm looking for lesions or this is how we check for mouth cancer or anything like that. And then I'm gonna look on the side of your cheeks, and everything looks nice and pink and clear. So it looks very, very good. Okay, and last I'm gonna check your cranial nerve number 7. And I'm just gonna have you stick your tongue way out and way back in again. So stick it out and then bring it back in. So that's very, very good. Okay, and we saw that you can move it around. And I think that's good, right? Perfect.